Urinary system, also known as a renal system, is responsible for the production, storage, and elimination of urine from the body. Urine is a liquid byproduct of metabolism in humans and in many other animals. Urinary system plays a vital role in maintaining body's fluid balance, regulating blood pressure, and eliminating waste products from metabolism. In this lecture, I will cover structures and functions of the urinary system, composition of urine, and diseases of the urinary system. The urinary system consists of several organs and structures that work together to perform these functions. The urinary system consists of the paired kidneys, their blood vessels, renal arteries and renal veins, the ureters, the bladder, and the urethra. Let's explore the structure and function of each of these organs. The kidneys are the main organs of the urinary system. We have two kidneys in the body, each about the size of your clenched fist. They are located on either side of the spine, just below the rib cage. Please note that the right kidney is slightly lower than the left because of the space occupied by the liver. Notice that each kidney receives a small branch from descending aorta. This branch is the renal artery. The blood entering the kidney through this small artery is under extremely high pressure. The ureters are narrow tubes that connect the kidney to the urinary bladder. There is one ureter for each kidney. Their primary function is to transport urine from kidneys to the bladder. Peristaltic contractions of smooth muscles in the ureter walls propel urine forward towards the urinary bladder. The urinary bladder is a muscular sac located in the lower abdomen. It serves as a reservoir for storing urine until it's eliminated from the body. The overall function of the urinary system is to filter waste product, excess water and other substances from the blood to produce urine. The urine is then transported from the kidneys to the urinary bladder through the ureters and stored until it is eliminated from the body via urethra. The urethra is tubes that connects the urinary bladder to the external opening of the body. It serves as a pathway for urine to leave the body during the process of urination. In males, the urethra also functions as a passageway for semen during ejaculation. The length of the urethra is shorter in females and longer in males due to anatomical differences. The urinary system works in close coordination with other systems, such as nervous system, which regulates filtration rate and urination, cardiovascular system, which perfuses kidneys so waste can be filtered. Blood pressure influences the rate of filtration. Blood reabsorbs water and solutes from renal tubes. The endocrine system regulates renal function through hormones. The kidney's highly regulated activity under the control of hormones from the hypothalamus and adrenal glands, which can alter cells of the kidney. All this and other system works together to maintain fluid balance and regulate various physiological processes in the body. Let's take a look at the mentioned organs. The kidneys play a vital role in maintaining overall health by regulating various body processes. Now I will explore the structure and function of the kidneys in more details. On this longitudinal section, you can see the basic structure of the kidney. The outer region of the kidney is called renal cortex. It contains numerous blood vessels and nephrons, which are functional units of the kidney. Each nephron, as you can see, consists of spherical capsule and long tubule. The inner region of the kidney is called the renal medulla. It consists of cone-shaped structures called renal pyramids. The pyramids empty into a hollow region known as renal pelvis. The renal pelvis is a funnel-shaped structure located in the center of the kidney. This is the first place where pools of urine collect. It collects urine from the nephrons and transports it to the ureter, which leads to the bladder. The kidney receives blood from the renal artery, which divides into smaller arteries and then two arterioles. The arterioles then get into contact with the nephron through capillary bed, called in this place glomerulus. The filtered blood then passes through the series of venules and veins and exit the kidney through the renal vein. Urine is collected in collecting ducts and leaves the kidney through ureters. Sometimes minerals in the renal pelvis crystallize and form kidney stones, which can block the flow of urine. The primary function of kidneys is to filter waste product, excess water and other impurities from the blood to form urine. This process occurs in the nephrons, where blood is filtered through the tiny blood vessels called capillaries. After filtration, the kidney selectively reabsorbs essential substances such as water, glucose, amino acids, and electrolytes back into the bloodstream. This process ensures the valuable nutrients and water are conserved in the body. The kidneys also secrete certain substances such as hydrogen ions and various drugs into the urine. This helps in maintaining the body's acid-base balance and eliminating potentially harmful substances. The kidneys play a crucial role in regulating blood pressure. They produce a hormone called renin, which helps control blood pressure by influencing blood vessels constriction and fluid balance. The kidneys help maintain the pH balance of the body by excreting hydrogen ions and reabsorbing bicarbonate. This regulation is important for proper functioning of the cells and enzymes. The kidneys produce a hormone called erythropoietin, which stimulates the bone marrow to produce red blood cells. Red blood cells carry oxygen throughout the body, and their production is essential for maintaining adequate oxygen levels. The kidneys are involved in the activation of vitamin D, a hormone necessary for calcium absorption in the intestines. Adequate levels of vitamin D are crucial for healthy bones and teeth. Overall, the kidneys play a vital role in maintaining fluid balance, electrolyte levels, acid-base balance, and blood pressure regulation, while also eliminating waste products and producing important hormones. The nephron is the functional unit of the kidney responsible for filtering blood and producing urine. Each kidney contains 1 million of nephrons. This combined effort helps maintain the body's fluid balance, regulate electrolyte levels, and eliminate waste products from the blood. Now I will briefly overview the structure and function of the nephron. Each nephron begins with a renal capsule, which consists of two main components. One of them is glomerulus, a network of tiny blood vessels called capillaries. The glomerulus receives blood from the renal artery. Its high-pressure filtration allows small molecules and fluids to pass into the renal tubule. Another part of the renal corpuscle is a Bowman's capsule, a cup-shaped structure that surrounds the glomerulus and collects the filtrate from the blood. The inner layer of Bowman's capsule is composed of specialized cells called podocytes, which help regulate the filtration process. The filtrate leaving the Bowman's capsule is very similar to blood plasma. After the filtrate is collected in Bowman's capsule, it enters the renal tubule, which is divided into several distinct regions. Proximal convoluted tubule is the first segment of the renal tubule located closest to Bowman's capsule. It reabsorbs water, electrolytes, and nutrients, glucose, amino acid, from the filtrate back into the bloodstream. The renal tubule descends into the medulla, forming a hairpin-shaped loop called the loop of Henle. The loop of Henle has two limbs, the descending and ascending limb. The descending limb is highly permeable to water, and ascending limb is not that permeable to water. Filtrate reaches its highest concentration at the bend of the loop. The ascending limb plays a crucial role in establishing a concentration gradient within the kidney, which helps concentrate urine. In here, salt is actively transported from the nephron into the surrounding tissue. Sodium, potassium ions, and chloride are pumped out of the filtrate. This active transport accomplishes two things. It conserves the salt and it maintains the hypertonicity of the kidney medulla. This is why medulla is the salty part of the kidney. In the ascending limb, as it climbs into the core kidney cortex, it tends to become isotonic with the circulating blood plasma of the surrounding capillary beds, meaning the filtrate is at its most dilute as it leaves the nephron loop. If you got lost following me, here I will zoom in and show you once again what is happening. What you just saw is this situation. Water is moving out of the descending limb and the salt, or better to say ions, moving out of ascending limb. Now remember, descending limb is permeable to water, but ascending limb is not. I want you to understand why water is moving out of the descending limb. Maybe for this I should orient symbols for salt this way, and for the water molecules this way. I hope you understand that it demonstrates the same event we saw before, only for better visual demonstration I put this in more compact order. Remember, this process is happening in the medulla, and now you know why medulla is the salty part of the kidney. It is because of the pumps that pump out salt from the ascending limb. Actually, sodium transporters are in the ascending limb moving out the sodium ions, and chlorine just follows. This creates a greater concentration of salt outside of the tubules. And as a result, this makes molecules of water move out of the descending tubule because of the osmosis. This makes the concentration of the solute higher in the descending limb comparing to the ascending limb. And as I pointed out earlier, filtrate reaches its highest concentration at the bend of the loop. After that, the amount of salt in the ascending tube gradually decreases. So what you see is that high concentration filtrate is going down deeper to the medulla, and low concentration stuff is going away from the loop of Henle. Because of the movement of higher concentration filtrate to low concentration filtrate is going in tubules in opposite direction with reabsorbing more and more salt, we call it countercurrent multiplication. It is happening in loop of Henle. Countercurrent multiplication in the kidneys is the process of using energy to generate an osmotic gradient that enables you to reabsorb water from tubular fluid and produce concentrated urine. This mechanism prevents you from producing liters and liters of dilute urine every day, and is the reason why you don't need to be continually drinking in order to stay hydrated. All right, now let's move on. Now we're looking at the distal convoluted tubule. Distal convoluted tubule is a tubule that ascends from the medulla and returns to the cortex. The distal convoluted tubule further modifies the urinary fluid or filtrate by reabsorbing additional water and electrolytes or secreting substances into the tubule for elimination. Several nephrons empty their filtrate into a collecting duct, which carries the modified filtrate through the medulla towards the renal pelvis. The collecting ducts play a role in fine-tuning of the concentration of urine based on the body's hydration status. You see, the filtrate has to traverse the salty medulla one more time as it flows through the collecting ducts. As it again enters regions of increasing osmotic potential, the urinary fluid may lose more water or not, depending on the needs of the organism. If you are conserving water, antidiuretic hormone renders the walls of the collecting duct, and distal tubule becomes permeable to water, which then leaves the nephron. If you have been drinking heavily, the walls become relatively impermeable to water, allowing excess water to flow on through the ducts and out of the system. Thus, nephron performs several key functions to maintain homeostasis and regulate fluid and electrolyte balance in the body. One of them is filtration. Blood enters the glomerulus under high pressure, which allows water, electrolytes, and small molecules such as waste products to pass the Bowman's capsule, forming the initial filtrate. Another function is reabsorption. As the filtrate flows through the renal tubule, essential substances like glucose, amino acids, salts, and water are reabsorbed back into the bloodstream, mainly in the proximal convoluted tubule. This process ensures that valuable substances are conserved and returned to the body. The renal tubule also facilitates the secretion of certain substances, such as drugs, ions, and metabolic waste products, from the bloodstream into the tubule for eventual elimination in the urine. The distal convoluted tubule is primarily responsible for secretion. The loop of Henle establishes a concentration gradient in the medulla, allowing the kidneys to produce concentrated urine by reabsorbing water, or dilute urine by allowing water to pass through. The collecting duct adjusts the final concentration of the urine based on the body's needs. Also, the nephron regulates the pH balance of the body fluids by selectively reabsorbing and excreting hydrogen ions and bicarbonate. The renal pelvis funnels urine into the ureter. As I identified earlier, ureter is a muscular tube that extends to the urinary bladder. The ureter is about 25 centimeters long and reaches a maximum diameter of 7.5 centimeters near the bladder. The ureter passes through the back of the bladder and enters it from the below, passing through its muscular wall and opening onto its floor. The ureter has 3 layers: an adventitia, muscularis, and mucosa. The adventitia is a connective tissue layer that binds it to the surrounding tissue. The muscularis consists of two layers of smooth muscles over most of its length, but third layer appears in the lower ureter. When the urine enters the ureter and stretches it, the muscularis contracts and initiates peristaltic wave that milks the urine from the renal pelvis down the bladder. The mucosa has transitional epithelium that begins in the kidney and extends from there through the bladder. The lumen of ureter is very narrow and is easily obstructed or injured by kidney stones. The bladder can extend and contract to accommodate varying amounts of urine. The inner lining of the bladder is made up of specialized cells that can stretch and prevent urine from leaking. Its muscularis, called the detrusor muscle, consists of three layers of smooth muscle. Mucosa has a transitional epithelium and relaxed bladder. It has conspicuous wrinkles called rugae. The opening of the two ureters and the urethra mark a smooth surface triangular area called trigone on the bladder floor. This is a common site of bladder infection. The bladder is highly distensible. As it fills, it expands. The rugae flatten. The epithelium thins from 5-6 cells to only 2 or 3. A moderately full bladder contains about 500 milliliters of urine and extends about 12 to 5 centimeters from top to bottom. The maximum capacity is 700 to 800 milliliters. Now let's take a look at the urinary sphincters. Sphincters are the ring of muscle surrounding and serving to guard or close an opening. There are two sphincters that help control flow of urine through the urethra. The internal urethral sphincter is involuntary muscle located at the junction of the bladder and urethra. It relaxes to allow urine to pass through the bladder to the urethra. Because of its location, it is also primary muscle prohibiting the release of urine. The external urethral sphincter is a voluntary muscle located at the opening of the urethra. The external sphincter consists of two layers of striated muscles under voluntary control. It can be consciously controlled to initiate or inhibit urination. Urethra is the lowest part of the urinary tract. The same sheet of mucous membrane that lines the renal pelvis, ureters, and bladder extends down into the urethra too, a structural feature worth noting because it accounts for the fact that an infection of the urethra may spread upwards throughout the urinary tract. The urethra is a narrow tube that is only about 1.5 inches long in a woman, but about 8 inches long in a man. In the male, the urethra serves a dual function, as the terminal portion of the urinary tract and as a passageway for movement of semen from the body. The female urethra serves only the urinary tract. On this, we finished with the organs and functions of human urinary system. Urine is the liquid waste product produced by the kidneys as a result of filtration of blood. It contains various substances the body needs to eliminate, as well as excess water and waste products. The composition of urine can vary depending on factors such as hydration levels, diet, medication, and overall health. Here I will provide you with the general overview of the composition of human urine. The practice of uroscopy, the examination of urine, extends back to the ancient Greeks. Information is still gathered from a patient's urine output today. From urine analysis, a physician can glean information about hydration, kidney health, and even screen for diabetes. It may be one of the first things you do when you get an appointment with your new physician. It is a routine part of the pregnancy checkups. The largest component of urine is water, making up approximately 95% of its volume. The amount of water in urine depends on a person's hydration status. Urea is a primary waste product of protein metabolism. It is produced in the liver as a result of breakdown of amino acids. Urea makes up a significant portion of the dissolved solids in urine. An adult typically excretes about 25 grams of urea per day. As urea goes stale, bacteria convert it into ammonia, which gives the familiar pungent smell of restrooms. Any condition which impairs the elimination of urea by the kidneys can lead to uremia, a building up of urea and other nitrogen waste in the blood that can be fatal. This happens in cases of kidney failure. To reverse the condition, the patient must undergo blood dialysis to remove the waste from the blood. Another component of urine is uric acid. Uric acid is a byproduct of breakdown of purines, which are substances found in certain foods and body's own cells. Excess uric acid can lead to conditions like gout. Creatinine is a waste product generated from the breakdown of creatine, a molecule involved in muscle metabolism. It is commonly measured parameter in assessing kidney function. Urine contains various electrolytes, including sodium, potassium, chloride, and bicarbonate. These electrolytes help maintain body's fluid balance, and are involved in various physiological processes. By the way, what electrolytes do you see on this slide? Sodium ion, potassium ion, magnesium ion, calcium ion, zinc ion, iron ion, chloride. Chloride is ion of chlorine. Sulfate, hydrogen phosphate, bicarbonate. The prefix bi and in bicarbonate comes from an outdated naming system and is based on the observations that there is twice as much carbonate per sodium in sodium bicarbonate as there is in sodium carbonate. Other waste products are ammonia, bilirubin, and excess salts can also be found in urine. Urine can contain traces of hormones such as cortisol and adrenaline, as well as various metabolites and byproducts of metabolic processes. It is important to note that composition of urine can be influenced by various factors, and any significant deviation from the normal range may indicate underlying health conditions. Urinalysis, which involves analyzing the composition of urine, is a common diagnostic tool used in the healthcare to assess kidney function and detect certain medical conditions. Urine is generally considered to be sterile when it is freshly produced in a healthy individual. That means that it does not contain significant amount of bacteria, viruses, or fungi that can cause infections. The sterility of freshly produced urine can be attributed to several factors. Urine formation. Urine is primarily composed of water, electrolytes, waste products filtered from the blood by the kidneys. The kidneys act as a filters to remove toxins and waste products from the bloodstreams, producing urine in the process. As a urine is formed within the sterile environment of the kidneys, it does not typically contain microorganisms. Urinary tract defenses. The urinary tract has several defense mechanisms that help prevent bacterial colonization and infection. This includes the flow of urine, which helps to flush out the potential microorganisms that have entered the urethra, and the presence of mucus and antibacterial substances that can inhibit growth of bacteria. Acidic pH. Urine is naturally slightly acidic, typically ranging between 4.6 and 8, with an average pH of around 6. The acidic nature of urine helps to create unfavorable environment for many microorganisms to survive and multiply. However, it is important to understand that the sterility of urine is not absolute. In certain situations, such as urinary tract infections, microorganisms can enter the urinary tract and proliferate, leading to an infection. In such cases, the urine may contain bacteria, white blood cells, and other signs of infection. Also, it is important to note that urine can become contaminated with microorganisms during collection and handling, which can lead to a presence of bacteria in the urine sample analyzed in a laboratory. One interesting fact about urine: perhaps you all aware of distinctive and even irritating smell around swimming pool. Chlorinated water has no smell. It's true. Dump a bunch of pool chlorine into a bucket of clean water and take a big whiff. What actually causes the smell around swimming pools is not chlorine but volatile substances known as chloramines. Chloramines form in pool water when chlorine combines with urine of the swimmers. Chloramines in the water, like dichloramide and trichloramide, irritate skin, eyes, and respiratory tract when they gas off from the water into the air above, particularly indoors. So now you know, the stronger the smell around the swimming pool, the more people urinated in the swimming pool water. Diseases of the urinary system can affect any of its organs and can have various causes, including infections, blockages, structural abnormalities, and other underlying health conditions. Urinary tract infections occur when bacteria and other pathogens invade the urinary tract, including the bladder, urethra, ureters, and kidneys. Common symptoms include frequent urination, a burning sensation during urination, cloudy or bloody urine, and pelvic pain. Urinary tract infections are also called bladder infections. Urinary tract infections are common, especially in women. More than half of women will have at least one urinary tract infection at some point in life. Urinary tract infections are serious and often painful. But most urinary tract infections are easy to treat with antibiotics. All women are at risk of cystitis because of their anatomy, specifically the short distance between the urethra to the anus and the urethral opening to the bladder. As a result, there is a less distance for bacteria to travel to reach the bladder. In addition, after menopause, a decline in circulating estrogen causes changes in the urinary tract. The changes can increase the risk of the urinary tract infections. Using diaphragm for birth control may increase the risk of urinary tract infections. Using spermicidal agents also can increase the risk. Urinary surgery or exam of your urinary tract that involves instruments can both increase the risk of developing urinary tract infection. You can help to prevent urinary tract infections by doing the following. Urinate after sexual activity. Stay well hydrated. Take showers instead of baths. Minimize douching sprays or powders in the genital area. Teach girls when potty training to wipe front to back. Kidney stones are hard mineral and salt deposits that form in the kidneys. They can cause severe pain when they pass through the urinary tract. Symptoms include sudden and severe back or abdominal pain, blood in the urine, frequent urination, and pain during urination. Urethritis is inflammation of the urethra and is lower urinary tract infection. The urethra is fibromuscular tube through which urine exits the body in both males and females, and semen in males. Urethritis, inflammation of the urethra, has a strong association with sexually transmitted infections, such as gonorrhea, chlamydia, and others. I hope you notice that itis means inflammation. Urethritis is the inflammation of the urethra. Cystitis, inflammation of the urinary bladder. On this slide, you can see urethritis caused by sexually transmitted infections. On both images, one can identify urethritis by seeing either the redness on the image A or darker area on image B around the urethral opening. Also, on the image B, you can see pus formed because of the urethritis caused by gonococcal infection gonorrhea. Pus is thick, yellowish, whitish or greenish fluid made up of dead white blood cells, dead tissues, and dead bacteria. It is produced as a part of the body response to an infection. In a separate lecture, I will cover sexually transmitted diseases. Now let's move on with urinary incontinence. Urinary incontinence is the involuntary loss of bladder control leading to the accidental leakage of urine. It can occur due to weakened pelvic floor muscles, nerve damage, hormone changes, or other underlying medical conditions. Kidney infections, also known as polyonephritis. Kidney infections occur when bacteria or other pathogen infect the kidneys. Symptoms often include high fever, back pain, abdominal pain, frequent urination, and cloudy or bloody urine. If left untreated, kidney infections can cause serious complications. Bladder cancer refers to the abnormal growth of cells in the bladder lining. It often causes blood in the urine, frequent urination, pain during urination, and pelvic pain. Risk factors for bladder cancer include smoking, exposure to certain chemicals, chronic bladder infections, and family history of the disease. Here are stages of bladder cancer. In stage 0, the precancerous lesions on inner lining are found. In stage 1, malignant tumor have spread into connective tissue layer. In stage 2, tumor have spread into muscular wall. In stage 3, cancer has started to spread to local organs or pelvic lymph nodes. In stage 4, cancer has spread to major organs. Cystoscopy is a key diagnostic procedure for bladder cancer. It allows the doctor to see inside the body within a thin, light, flexible tube called cystoscope. In this slide, you see cystoscopy procedure done in male and female. A cystoscopy provides a visual of the lower urinary tract and bladder lining. Chronic kidney disease is a long-term condition in which kidneys gradually lose their ability to function properly. It can be caused by various factors such as diabetes, high blood pressure, certain medications, and autoimmune diseases. Symptoms may include fatigue, swelling in the legs and ankles, changes in urination frequency, and persistent itching. The disease starts with mild loss of kidney function, then develops with moderate loss of kidney function, ending with severe loss of function and final kidney failure. In earlier stages, as kidney disease progresses, one may notice the following symptoms: nausea and vomiting, muscle cramps, loss of appetite, swelling via feet and ankles, dry itchy skin, shortness of breath, trouble sleeping, urinating either too much or too little, Treatment for chronic kidney disease focuses on slowing the progression of kidney damage, usually by controlling the cause. But even controlling the cause might not keep kidney damage from progressing. Chronic kidney disease can progress to end-stage kidney failure, which is fatal without artificial filtering, dialysis, or kidney transplant. Polycystic kidney disease is an inherited condition characterized by growth of numerous fluid-filled cysts in the kidneys. Over time, the cysts can enlarge, leading to kidney damage and impair kidney function. Common symptoms include abdominal pain, high blood pressure, blood in the urine, and recurrent kidney infections.